In the name of God, dear friends, I'm Dr. Talebpour from Iran, and I want to speak about one of the most important points in laparoscopy, which is the basis of laparoscopy. If you want to do laparoscopy without any terrible and in relaxed and calm condition, you have to know and keep it in your mind always during your operation, these important basic points of laparoscopy. If during operation you think that there is some problems, please return and check again these important points, and you can find out that by correcting these points, the operation gets easy for you. The main important point during laparoscopy is ergonomy, which included the position of the patient, the monitor, doctor, and the location of trocars, which points at the abdomen. These trocars are inserted, which should be based on the diamond shape strategy. And by this way, you can do the operation in the best condition. The second point, which is very important, is insufflation. The patient should have enough insufflation to get it easy for you. The second point, which is very important, is insufflation. As you know, the space, intra-abdominal space, is not real space, and by insufflation you can do operation and enough pressure, which is routinely about 15 millimeters of mercury of CO2, and with the range of 18 to 12 is something that we are allowed to make insufflation. The speed of gas, warmer, capnometer, and something like this are very important to help the patient and the doctor to do the operation without any problem. And the relaxation of the patient is something which is very important. If during operation suddenly you see that the operation is impossible, please check again the relaxation of the patient, your insufflator system, the pressure, intra-abdominal pressure, the speed of the gas insufflation, and something like this. This is another important point which we have to check always during the operation. The third point, which is important in my mind, is the potential to change the position of the patient during the operation. Sometimes during the operation, you can find out that some special maneuver is very difficult, and you cannot do the suture, for example, at some special point, or some dissection in some unusual conditions. So please change the position of the patient. For example, if you change the patient upward or downward, the space change, and the small intestine may be loose into another part of the body of the abdominal cavity, and by this way the field of operation gets easy for you. So these three important points are very, in my mind, very important and basic and fundamental conditions which we have to keep in your mind to check it for every time during laparoscopy, including ergonomy, insufflation, and position. Thank you.